So I went in to go and test my eyes. They tried to check the thickness of your corneas and also to try to figure out the prescription of your eye. I did the first machine, and then for some reason the second machine ended up not working, so I had to come back during my pre-op to actually use that second machine.
Okay, so this is called pachymetry.
Oh, Lord.
This is an ultrasonic pachymeter. So your eye is numb. I'm going to touch your cornea. You're not going to feel anything. It's going to tell me how thick your cornea is. Okay?
Hey guys, so this is day one. This is my pre-op. I just got in from the terrible snow outside. So today they're going to dilate my eyes, make sure they're good and ready for the operation, which will be tomorrow if there's not even more snow that locks me inside. All right.
Just gonna read you these. That's just this one, just to see how your cornea looks.
Sure.
Since you've been out of contacts for the week, okay?
Sure.
All right, so go ahead, blink, blink, blink.
Okay.
Great, hold that. Here we go.
So here she basically was taking pictures or x-rays of my eyes with the blue light. Then if you look in the corner where the computer screen is, you can see the pictures of my eye.
Great. Okay, you can lean back.
All right. Guys, my eyes.
All right, ready? Here we go. You're doing great. As soon as I have enough, I'm just gonna shoot over to the other side, okay? So at that point, you can blink all you want. Bear with me, you're doing great. Excellent, go ahead, blink, blink, blink.
And that's where it all goes down. I'll be me tomorrow, so don't chicken out. So she just took my glasses to take one last measurement, and she asked me how old they were, so I'm not really sure what that means, but yeah. I can't wait. Like I'm really ready. Like very, very ready. Like walking here in the snow and like not being able to see, I'm over that shit.
We're doing both eyes for distance. You're way too young to do it. Okay.
So I am back from day one, my pre-op. Something pretty interesting happened. You know, I was supposed to do Intralase LASIK. That's supposed to be the new and improved. They only use a laser situation to get the eyes done. But the doctor that was doing my test said that my corneas are pretty thin, but I do have a low prescription. So she wasn't sure if the surgeon would recommend that I do PRK instead. So PRK is another type of laser eye surgery. But with this one, they brush off a layer of your cornea, and then you have to wear a contact lens for about a week. And then you take it off, and it does basically the same thing. You get to see amazingly, but the downtime is a little bit longer. It's 2 to 3 days of downtime instead of just the 24 hours. So she said she will talk to the surgeon and get back to me. And of course, my freaking luck, I have to do PRK. So for me, the issue with the PRK is the fact that I now have to take more prescriptions. So you're probably wondering what kind of prescription. So the 24 hours before you'd have to take your LASIK, you have to use some certain eye drops. So you use two types of eye drops. They are a antibiotic and an antibiotic, and then I think like a regular one that's for like dry eyes. I'm gonna check actually to tell you guys the right thing. Is an antibiotic eye drop and a steroid eye drop. So you're supposed to start the antibiotic the day before your surgery, and then you continue with the antibiotic and steroid days after. So because I have to now do PRK, I have some extra eye drops that I have to take. And let me tell you the truth. I knew they might be pricey. I knew they were definitely probably going to cost more than eye drops in Nigeria. But, yeah. So I was sitting in the reception of the, the eye center. And I saw this card. I don't know if y'all can see it. I'm going to put a picture. Okay, I think I can see it now. It's called Good RX, and it is good. It's very good. It is a prescription discount card, and I just knew, I was like, I know I don't have insurance in America right now, so I'm definitely gonna need to get as cheap as possible for this prescription. So I went, they called in the prescription. I went to my local Walgreens, and the guy was like, oh, it's 3 prescriptions. He was like, it's pretty expensive. He was like, do you have insurance? I was like, no. But he saw that I had this card in my hand, so he was like, okay, let me get it down for you. So originally the price was supposed to be like 100 something. Then he first got down to like 83. And then he said, let him work on something some more. Let him try and get some more discounts from it. So then when I came back to, to see if he got the discount, he was like, oh, the doctor actually put in another prescription. I was like, damn, that means my eyes are really fucked up or something. So 4 prescriptions, and yeah, luckily the good RX card worked on 3 of the prescriptions, but not the 4th one, of course. And the 4th one, of course, happens to be the most expensive. So for 4 eye drops, I spent about $155 on some fucking saline solution, guys. Of course, if you are an insurance holder, you have insurance, it's gonna be way cheaper for you, obviously. But us that are out here just trying to see, do our best in life, I have to pay for it. So there are 4. I haven't opened them yet, but they're still in this little thingy. So I'm gonna open them now and let you guys see. Okay, so this is pretty funny and interesting. Hope you people don't see my address. Well, it's not even my address anymore. So here's everything. It's very funny that the eye drops did not get any discount from that card. But this is what I'm supposed to take a few days before the surgery. So this is the antibiotic. And then this is the steroids, what I'm supposed to take, after I start surgery. So now I realize the other 2 prescriptions were acetaminophen, or however you say that thing, and ibuprofen. So I realized these must be for after the surgery, because the PRK is supposed to be a little bit uncomfortable, which is now kind of scaring me because I didn't expect to I need to take pain relievers. What's interesting is that I typically don't use ibuprofen or acetaminophen. I usually use naproxen sodium when I'm having headaches or uncomfortable. So it'll be interesting to see if these work for me. I knew that it would be uncomfortable, but I didn't think I'll have to take pain relievers. And these are similar types of pain relievers. Why would I be taking 2 pain relievers at once? Yeah, it's kind of strange. So we'll see how that goes. So these are also 2 other things she gave me. I'm supposed to be using these eye drops here to lubricate my eyes before we do the surgery. And then she said to just clean up my eyelids. It's called a lip scrub. Never heard of this before. But at night when I wash my face, I have to use this to kind of really, really screw up my eyelids. So that means, I know I kind of have dry eyelids in general, but I didn't think they had things for it. But yeah. So yeah, we're almost there. It's so close. It's kind of scary now that I have to do this PRK that I wasn't expecting to have to do, and now I have all these pain relievers, and I actually hate taking medicine 100%. And the PRK, I was supposed to start doing the eye drops 2 days before the surgery, and now it's just 1 day because last minute we're changing surgery. But yeah, I'm gonna keep you guys up to date. I'm just gonna be using the eye drops as I'm supposed to, and let go. Okay guys, so today is the day, and probably the next time you see me I won't have glasses on. For some reason, I don't know, I have a headache and my chest hurts a little bit. I didn't think I was nervous, but maybe I am. I think probably because I'm doing the PRK surgery, which is different than the Intralase that I planned for, but I'm ready. Hairnet and ear swabs. So anytime anything is dripping out of my eye, it doesn't enter my ear. So the aftercare for eye surgery is what's most important. They'll fix your eye while you're at the place, but if you don't follow the instructions of what to do afterwards, then you're on your own. So I actually have to take a lot of drops and a lot of drugs and a lot of things and a lot of times a day to get it done right. So I'm gonna show you guys what I gotta take. So you'll see is a bunch of some eye drops, some different prescriptions, just a bunch of stuff. I already got the eye drops and the ibuprofen. I see Vicodin there, which is kind of scary. But yeah, a lot. Look at something. Look at this. Artificial tears, refresh Optive, 2 hours for the first 3 months. 3 months. Oh my God. At least 8 times per day, homo.
All of them, so a minute apart, and then you wait 5 minutes after all the medications and do a couple of drops of artificial tears per eye, okay? Reason being, the Cipro sometimes, besides the stinging, it tends to travel down and have a really bitter taste in your throat. So a good way to prevent that is to wait 5 minutes and then do a couple of drops of artificial tears to flush out that excess,
Makes
okay?
sense.
Yeah. So let's say you came home, you waited the 4 hours, you put everything in once, and you fall asleep. Sleep is the best thing for you today. If you fall asleep, sleep. Let yourself sleep. You don't have to set a timer. You don't have to have anybody wake you up every 2 hours. Let yourself sleep. Whenever you naturally get up, you can go ahead and put them in. Yeah. If you wake up to use the bathroom, to eat, you can put them all in again, go back to sleep, whatever you'd like. Okay, you don't have to. But if you are awake, it's going to be first time everything, then every 2 hours, then every 4 hours, then every 2 hours, then every 4 hours. Okay, so it's just like alternating. But yeah, so today's pretty fluid. If you only use it that one more time after the 4 hours, that is perfectly okay. That's fine. Starting tomorrow, it's going to be more diligent, okay? So these guys, the zipper that you're going to pick up and the pred that you already have are going to be paired together. Okay. You're using these guys together, both of them 4 times a day for the next 6 days, okay? And then you're also going to pair the Ketorolac with the pain pills. You have 2. They are alternating, right? There's going to be ibuprofen 800, which is the lower strength one, and you also have a low dose Vicodin in case it's very uncomfortable, right? With PRK, today's going to feel great. Tomorrow's going to be like a little bit more uncomfortable. The 3rd day is really the worst of it, and the 4th day can either be slightly better, slightly worse, and then the 5th day, it really is when it starts to get better and better and better and better. So that's that little hump you have to get past before it's smooth sailing, okay? But that's why we give you stuff to help manage if you are feeling uncomfortable. But PRK is very particular. Some people don't experience any pain, and some people, you know, it's just pain threshold. Everyone has a different tolerance, okay? So you've got those options. Then those are going to be 3 times a day for the next 3 days. So just pair it off with your meals. Think breakfast, lunch, dinner, okay? Pill and drop. If it doesn't hurt at all, you don't have to take any of the pills, right? That's up to you. But do keep using all of the drops up until you stop, all right? And so that's, these guys you'll be done in 3 days for this one, and this one for 6 days. And these guys you're going to continue probably for the next. I love saying forever, yes. Forever. No, but really. Okay, and then you were right. So this one stings when you put it in, right? The reason it stings is that the surface area of your eye is dry, right? It's winter. Everyone's eyes are dry. That's perfectly normal. Before surgery, not a big deal at all. But after surgery, I want you to use that as an indicator for yourself. If you are noticing that when you use this, it's still stinging a little bit in the beginning, that's just a mental note for you to up the dosage. Do this instead of, because you're drying out in between those 2 hour intervals. So do it every hour instead, or every half hour, more often. I highly encourage you, especially in the first few weeks, to use it as often as you can. This is the go time, right? Your eyes are healing, your cornea is growing back, your vision's stabilizing. You want to keep your eyes as hydrated as possible because that's the environment they need to do the healing they need to do, okay? So just use this guy. They're great. All right, so let me grab your post-op kit and go over that as well. I'll also bring you the ibuprofen.
Okay, thanks.
Worth at most, so do make sure you get more. You can get it from us, from the pharmacy, when you go pick up other meds. Doesn't matter what brand you get. We like Refresh, we like Blink. Doesn't matter as long as they're preservative free and they come in these vials. So you're looking for something that looks like this. Okay, so guidelines for how to use these guys. They're marketed as single use, but they're not really. There's about 10 drops in each one of these. So if you're doing it every 2 hours, that's about a day's worth. So you want to utilize that. Once you snap this top part off, it clicks back on, it closes. You can throw it in your pocket, pull it out next time you want to use it, okay? But because they are preservative free, there's nothing in here to preserve them. So you want to make sure once you do open it, think 10 to 12 hours. Don't keep them overnight, okay? So morning, use it throughout the day, end of the day, toss them, open up a new one the next day. So this is why at most, this is 2 days worth, okay? So make sure you get more soon. That's these guys. And you keep these also in the fridge. They'll also feel nice for your eyes, okay? Most important part of this kit. For the next 7 days, every time you go to sleep, you're going to be wearing these special eye shields over your eyes, okay? Pointy side in over this middle part here, like this, okay? And there's a second one there that's going to overlap, maybe not. Everyone's face shape is different. And a big roll of tape that you're going to use to secure it to your face, okay? I like to start with the one across the top like this. That way it's on your head. You have 2 free hands now to pull off more. You can put one down the middle, down the side. You can go zigzag across. There's really no wrong way to secure this as long as you feel it is securely on your face. That way while you are sleeping, you do not rub your eyes. If you lay face down, you don't put any pressure on your eye. And most importantly, you don't move that contact out of position, right? You protect your eye while your cornea is growing back, okay? So that's 7 days. So today's Friday, so until next Friday night, starting next Saturday, you'll no longer have to, okay? Same thing with these sunglasses. For the next 7 days, day or night, these are your super fashionable, super cool sunglasses, okay? They are 100% polarized, so they're very good against UV light, and they are wraparound, so they'll keep dirt, debris, wind out of your eyes. So day or night, even if it's dark at 5 o'clock, raining, snowing, whatever it's doing outside, whatever the weather is weathering, these are going to be on your face for the
Okay, so
next
as long as
7
I go
days.
outside, but what if I'm in the house?
Inside you're fine.
Okay.
You don't have to wear them. Yeah, no, just today we're gonna put them on you after surgery in case you're sensitive to light, which happens sometimes. So just in case, but generally no, you don't have to wear them indoors. Okay, just outside for 7 days.
Sure.
After that, you can wear your own sunglasses, but do still wear sunglasses for the next 3 to 4 weeks.
Sure.
Okay. Yeah, that's about everything.
Awesome. We're ready.
Right on time.
All right.
Hey, Doc.
Are you watching the video, man?
I'm videoing you. The world is gonna see you.
All right. 2020, this is going to be good about not rubbing the eyes. And sunglasses in bright sun. I just want to limit the variables. So
Gotcha.
you go predictably and properly. So,
And I appreciate that.
yeah. And remember, when we're on computer, when we're on smartphones, we blink less often, we blink less fully. We have partial blinks where our eyelids do this instead of fully compressing. And that compression is so important to get the oil out of the meibomian glands, these glands in the oil on the edge of the margin. So, do those good things in your kit. Nothing to memorize, but in your kit I have a little suggestion sheet that's going to help you with these pearls. This time of year I really love to have humidifiers on my bedside or around my computer station because we have heaters on.
Yeah, yes, that makes sense.
So doing those things great. Why are the sunglasses so important? Well, because if we get too much UV light exposure while we heal, we can heal more aggressively, tend to recruit more tissue, get our nearsightedness back to some degree. Why is rubbing an issue? Well, obviously it can weaken the cornea because we're pushing against the bridges of the cornea, but it can also create astigmatism. So even more often than people get a weak cornea, people get their astigmatism back, and that can be a problem. So do a great job. We got a little 3-month marathon to run. We're gonna be good. Some housekeeping points here. I tell all my patients 1 in 10,000 is the statistics on an infection. I haven't seen one in over a decade, but it's typically somebody not being good with their antibiotics or something. Dryness usually 3 months, but it can be up to 6 months or more in some outliers. It's just usually somebody who already has baseline dryness is the people who struggle a little longer. My IT guys, my accountants, what have you. Glare and halo around lights this week, not uncommon, but very uncommon long term. And I've never seen a cosmetic deformity. That would be somebody with an eyelid that droops or something. But that is in the literature. What I have seen is people be more aware of their pre-existing anatomy.
Yeah, because we can see our faces now.
Exactly.
Because we don't wear glasses anymore.
You got it. So I just need initials here. We are the
Hey
laser
guys, this
room.
is Dr. Stetson, and we're here.
This is where the magic happens. That's right.
Okay, so the next time you guys will see me will probably be tomorrow because I know I'm not supposed to really use my eyes today. So wish me luck. Well, guys, I actually got a chance to come and say hi to you guys. I am done. I can actually see through my eyes. It's a little bit blurry, one, because I'm wearing these glasses, and because I just literally had eye surgery. But because I did the PRK surgery, which is different than regular laser Intralase, I don't have to stay like a few hours and stuff. So I'm about to go. Okay, guys, so this is the end of day 1. What's my experience like? So yes, I've put on the eye guards. I don't know if I taped them well, but I've taped them, and this is what I'm looking like. Day 1, what was it like? So I left the clinic around like 1 o'clock-ish or so. So as I was on my way to get on my way to the pharmacy to get the remaining eye drops and stuff, I don't know if I was playing around with the glasses too much or if it's just, effects of the fact that I just had eye surgery, but my right eye started to like feel a kind of way. I could definitely feel like something was going on. So I definitely felt like a little bit of dryness or pinching. Like I felt like something, definitely felt like I needed some drops or something, So then it progressively got a little bit worse. Then it would get better, So I did all the drops that I was supposed to take. I did find myself, I'm supposed to do the artificial tears every 2 hours, but at some points I felt like a really strong sting. So I did do the drops at a point like every 1 hour. Yes, I'm trying to keep up to the drops. This eye is feeling better, and now it's kind of like switched over to this eye. But they're not too bad. They definitely don't feel as bad. Well, this one doesn't feel as bad as it did earlier. This one's getting a little bit better because I did just put in the 2 artificial tear drops. What else? Yeah, they put in the tear drops. But yeah, I feel like a little bit of dryness. I feel like there's something in my eye, Like when you have a dry contact lens, that feeling? Yeah, I definitely feel like I have something in my eye. So I'm going to keep on going. My cousin also did PRK, and she said day 2 was the worst for her. But the nurse at the facility told me day 3 will be the worst. So we'll just see. We'll see how it goes. I'm going to I'm hoping for the best, because I don't want to have more pain. So I'm off to sleep. I'll see you guys in the morning. Good morning, guys. This is day 2, morning of day 2. So I've actually had like 2 parts to this morning. So I first woke up around let's say like 4 or 5 o'clock in the morning to go to the bathroom, and my right eye was on flames. Probably like the worst it has hurt this whole time. So after going to the bathroom, I immediately put in the artificial teardrops into the eyes, and it did take me a little bit of time to get back to sleep because I was pretty uncomfortable. And I was sitting there like, oh my gosh, should I take the Vicodin right now? Like, I was like, this is not gonna work. I was like, nah, this is not it for me. So I ended up falling asleep. So I've woken back up now, and it's around 8:30, and my eyes feel pretty okay. Like, they definitely feel maybe like dusty, like maybe like some dust in my eyes, but they feel much better. This one and this one. This one had always felt pretty okay, but they both feel a little bit dusty, but they definitely feel like I can be cool. Like, as soon as I put my drops, I should be fine. So I will let you guys know how the day goes. Hey guys, so they were right about day 3. I woke up and my eyes are hurting so bad. I put all the drops in, and I'm gonna take a Vicodin. Like, it hurts to like open my eyes. Yeah, so my right eye is of course always hurting more than this left eye, but the left eye kind of hurts now that I put the drops in. So yeah, this is me literally after all the drops. So I'm just gonna take a Vicodin and try and go back to sleep. Hey guys, so it's still day 3. I feel a little better than what it did when I, earlier. But yeah, it definitely feels like, if you ever had your eyes swollen before, it definitely feels like it's swollen or there's something inside of it. So yeah, I would also say, if you're someone like me who tries to go the affordable route with things, I bought the Walgreens versions of the Refresh and Blink drops. And the Walgreens version of the vials, you cannot pop the top back on. So they really want, because really with those vials, you're supposed to use it and throw it out, which, I mean, come on, like, who has money like that? So when I was at the facility, they told me that you can actually put the top back on and be able to use 1 vial a day instead of one vial per drop. So with the Walgreens ones, you actually can't pop the top back on. I've tried. I'm gonna try it again once I open another one. So yeah, you might have to bite the bullet and make sure you buy the Refresh or the Blink ones if you want to save the vials. Like, the drops are the same kind of drops, but you can't use 1 vial all day. So yeah, I just want to come in and let you. As you can see, I can't open my eyes. Like, it hurts. I mean, I can open my eyes obviously, but it really hurts. So I'm just gonna keep my eyes closed. Hey guys, so it's a week later and I am back. I'm here to get the contact off my eye and see whatever else they're talking about. Yeah, I can see pretty well. I definitely feel like my eye is dry. I think it's because of the contact, but yeah, we're here, so let's go. So my contacts are out, guys, and you can see I've switched to my regular glasses now. So she said that my corneas are healing perfectly, but they are a little bit swollen now, so I'm probably gonna see a little bit fuzzier than when walked in. So it feels a little bit more blurry, but I can still definitely see. She said by tonight my eyes should be like way better than over the weekend. My eyes should be even better. They will continually get sharper, and especially with PRK, it takes a little bit of a longer time to heal, so everyone heals differently. But over the months, weeks, days, months, whatever, I'll be able to see even better. And what's so funny is that anytime I look at something, I'm not sure if I'm seeing it my best, because I've never really been able to see before. So yeah, but again, something that's really interesting is that I have another eye drop that I now have to start using. So I'm gonna go get that now, and then once I get it, I'll tell you guys all the details about that one. So yeah, it's a vision. So I have to keep wearing sunglasses for at least 2 weeks. I mean, we're supposed to wear sunglasses anyway to protect ourselves from UV rays, but yeah, I should definitely keep on wearing sunglasses for the next 2 weeks. So yeah, if you know I can get some cool sunglasses, link me. Another funny thing that I noticed when she was checking my eye to make sure everything was good, my right eye that has been hurting me the most was seeing better than my left eye. So that was pretty interesting. I think it's because it had the astigmatism, so it's better to see far and near, but I'm not really sure, but yeah. So I am about to go to the park, just do a little bit of sightseeing, and I'm going to my house. Hey guys, so it's me, and it has been 1 month since I did my PRK surgery. I actually wrote some notes of things I want to talk about. And there's some things that happen along the way, like during the length of the video, but I couldn't really put everything, or I wasn't able to record everything because they were actually working on my eyes. So let's go. A month later, what I still have to do every day is I'm using these drops. I was prescribed these drops on the day that I took my the 1 week after the surgery. So I stopped using all those other drops and things they gave me the first time, and I had to start using these drops. So I had to use these drops. I had to use them 3 times a day for 2 weeks, 2 times a day for 3 weeks, and then 1 time a day for 1 week. So I'm already now on the 2 times a day for 3 weeks. When I originally bought it, I bought it in the States. I got it for $40, but I did find it in Nigeria at my regular eye doctor's for $3K. So if you do get your eyes done in the States and you're wondering, will I be able to get these things in Nigeria? I was able to get it in Nigeria. So I use this now 2 times a day, and I am still using my artificial drops. What's really interesting is that so many people complain about like dryness and things like that. I rarely or barely feel like my eyes are dry. In the morning, they definitely are a little bit drier because, you know, you're not doing anything, you're not blinking, anything like that. So I go ahead and put in these drops and then put in my artificial tears. I even forget that I'm supposed to be doing it 8 times a day or however many times a day. I remember that I'm supposed to be doing it, but I don't feel like my eyes are dry. Once in a while, maybe if I go outside or something, I feel like my eyes are dry, and I'll just immediately put in my artificial tears, and I'm good to go. I feel great. I can see, like, as I'm looking around, I can see everything, and it's truly an amazing experience. Like, this is truly a life-changing experience, and I'm glad I was able to save up the money and get it done, because I never knew until I said I got my eyes done that I even talked about it while I was in Big Brother house. But I always knew that LASIK was one surgery I wanted to get for sure. Yes, we say our boobs, we say BBL, we say all these things, but LASIK or laser eye surgery was something I knew I had to do for my life. And what really made me know that the time was the pandemic, or this whole COVID experience. Wearing glasses and wearing masks are the worst. First off, your ear is on fire because there's so many things, your ears holding so many things, and then the fogging of when you go from cold weather, AC to hot outside. So I was like, yo, I'm totally over this thing. I had to move along. So I did get my surgery done at the Diamond Vision. They have 4 different locations: New York, New Jersey, Connecticut, and Atlanta. They have a couple of offices in each of those places. So I mean, the service was amazing. I recommend that every single person in the world should go ahead and get their eyes done there, especially because it was pretty more affordable than anywhere else. So I did pay for this surgery, guys. I am partnering with them, so they did give me a discount, but I still paid for this surgery. Best believe I paid for it, and I saved years for it. So in general, the cost of the surgery is about $2,500 per eye. It can go up, it can go less, and I do believe that Diamond Vision is a little bit cheaper than many places. But in general, it's about $2,500 per place. I think most people that I know got theirs done, their 2 eyes done between $5,000 and $7,000. So, or maybe even less than that. But that's the range. Is kind of in that range. And the reason I say $2,500 per eye, because there's some people who only need to get 1 eye done, because some people are perfect in 1 eye and not so perfect in the other, or in general, that's kind of how it works. So I did get my 2 eyes done, and they did give me a discount. So originally I was supposed to get my eyes done last year, and COVID happened. I didn't get to travel, everything like that. So then when I came back this year telling them I wanted to continue with the process, they told me that the price went up, so I even had to pay even more than I expected. And what happened last year is that I had saved up the entire 2019 to get my eyes done, and then pandemic happened, and most of us weren't really working. We weren't really, money wasn't really coming in, so I ended up tapping into that money. So I had to double up once the world opened back up to make sure I was able to pay for this test, and then add the additional money that they said they've now increased, because not only did I have to pay for the test, pay for the surgery, I had to pay for my flight to get to the United States. So yeah, it's been great. Everything's great. The best things for me now with my eyes is that, I never really knew what great vision was, or per se. With the glasses, you can see well, but then with this laser eye surgery, you can see even better than you did when you had your glasses on. And something that's so funny, I told my friends, like, I didn't know I looked like this. And they laugh, like, you even wore contacts. What do you mean you didn't know what you look like? But like I said, I can see even better than what contacts were giving me. And my favorite thing now about having eyes is that I can see myself in the shower. I know that sounds strange, but in the shower is probably the place where you really couldn't wear corrective lenses. You definitely can't wear glasses in the shower. And even contacts. You're not really supposed to, wear contacts in the shower unless, nothing's wrong with it. Most people don't really wear contacts in the shower. So now I can really see everything that's happening to my skin. So it's a great feeling to be able to see everything now. So I recommend every single person to save up and get this done. The way people are saving up to get their behinds done and get their boobs done and get their noses and their foreheads and their chins, your eyes, I mean, eyes are literally your health, you know? They're really seriously your health. So I would advise everyone to try to save up for it and get it done. I mean, it's not easy. I told you guys, I took at least a year, if not more than a year, to save for this, and I made sure I saved it in a separate account that I did not touch. Like, I knew for sure I was saving for laser eye surgery, so I made an account just for that, and I saved up. So I did do mine in New York at Diamond Vision. So the people who won't be able to make it to New York, we know that not everyone's going to make it to New York. If you are in Africa, I'm going to just assume that South Africa or Kenya or even Ghana probably has places that are, you know, reputable when it comes to laser eye surgery. Apparently, there's a place in Nigeria that is now claiming that they do laser eye surgery. Funny thing is, I contacted them about maybe when I started saving up for laser, and they didn't respond. They didn't email me back. They didn't answer my calls. And I said that recently when someone told me that this place does the surgery. And I was like, they have terrible customer service. So they send me a DM like, sorry about what happened that time. We don't know, but you should come in if you need your checkup. So I will probably go there for my checkups. And if the service is suitable, I will come back to tell you guys about their service. So let me tell you about the surgery proper. You lay down on the hospital bed or the surgery bed, and they gave me at Diamond Vision, they gave me like the squeeze toys and this teddy bear just to kind of cool me down and calm me down, because I did not pay for the anxiety drug. One, I've gotten different procedures before, so I didn't really feel like I needed an anxiety drug, nor did I want to pay for it because I'm cheap. So once you lay down, you know, you get comfortable, they put this contraption that opens your eye really, really wide, you know, like a clamp kind of thing. And then they begin to put the eye drops, the numbing eye drops, and then the steroid and antibiotic that you got from the prescription, and then some other stuff, you know, to get your eye ready. So then they go ahead and bring out depending on which laser surgery you're getting, I guess they either use the physical blade or the electrical blade. But for me, they use the electrical brush. It's kind of like, I felt like it was like a electric toothbrush, and they scrub my cornea down. So I could literally see, because you are awake when this is happening, your eye is just numb. You can definitely feel like a little bit of pressure, but it doesn't hurt. It kind of feels like you're getting your nails done. And so you can go from, okay, I can see something that's red and black, and then once they scrub it, it feels like it's scribbled out. So like, you know, when the TV is doing that ashy, you know, that ashy thing, that's what your eye ended up looking like. And then they put the laser on, and then your eye works. So with the laser, you can hear the laser. It goes, and you can also smell the laser. So when I say you can smell the laser, it is heat. It is a laser, so it kind of smells like barbecue. There's a smoky element to it, but it's super quick. On this eye, the laser was on my eye for 31 seconds. My prescription was minus 3.25, and I had astigmatism on this eye. That's the reason I feel like my eye was always hurting more on this one, because it had the astigmatism and the laser was on longer. This eye prescription was minus 3.75 and no astigmatism, and the laser was on it for 29 seconds. So after that, they just basically use water to wash your eye, and you can see it's amazing. So I don't know what my new prescription is now, but I can see. So I'm not even worried about what it is now, but I can definitely see everything. So when it comes to this, I highly recommend you get laser eye surgery, and I highly recommend you go to Diamond Vision if you are opportune to be in New York, New Jersey, Connecticut, and Georgia. Especially when it comes to Diamond Vision, they were super affordable. They answer all your questions. It was easy, breezy. Dr. Setson has been in the industry for years, so obviously someone that you would, you know, trust with your health. Your eyes are your eye health. You know, they're definitely, even though it is an elective surgery, it is something that is totally worth it and worthwhile. As we get older, our eyes get worse regardless. So to be able to see for money is so, if you got it, why not? So I advise everyone to it shouldn't be, should I get this surgery? I'm afraid of the surgery. It should be, when will I get the surgery? Because the only thing stopping you from getting laser eye surgery is finances. Let's just keep it G, you know, let's keep it straight. The only thing affecting you is finances. So if you're not opportuned to get to, you know, the United States to get it done, I advise you to just do the research and try and find out which places in your area have it. Find out how much it costs. Just go up and get the consultation, you know. Find out how much it costs and start to save up for it. You need to get it done. If you can afford it in your 20s, get it done. If you can afford it in your 30s, if you can afford it in your 40s, whenever you can, I advise every single person to get this surgery done. If I become a billionaire, this is something I would want to give to people as philanthropy. The power of sight. It's not until you can see that you really know what it is. Because I tell people all the time, you know, we that wear glasses, we know how hard it is to wake up and not see. And people who can see don't know what that means. So now that I can see, I'm so much more grateful. You know, like it's amazing. And I always told myself I wanted to get laser eye surgery for various reasons. One, because I didn't want to, even though I did love, when it came to between glasses and contacts, I loved my glasses because it helped me to hide all the things on my face I didn't like. But it was just annoying to have to deal with, it's first thing in the morning, you're looking for your glasses. Or if you lose your glasses, you need to have glasses to find those ones. So that whole thing is, oh gosh. And then especially once I started modeling and acting and getting my makeup done damn near every day, I hated the idea of always having to put on contacts and all that kind of stuff. So I knew I need to get a laser. And then I had a little bit of an even more intimate or personal reason. I always told myself that if I was to get married one day, I want to be able to wake up every morning and see my husband, like actually see him. I knew he would be there on the bed next to me, but I wanted to see him, see everything of him, And now I can. So someone's son, where are you? Baby girl is ready. So again, guys, this is my review of my laser eye surgery, particularly PRK, that I got done at Diamond Vision in Manhattan, New York. And I advise every single person to get eye surgery if you do have eye issues. This is Anto, and I'm signing out.